Physical therapy is essential to gaining mobility and improving your quality of life. Corey DuPont, physical therapist with Saltzer Home Health, explains how you can take those steps towards healing in your home. Corey, give us an idea of the type of patients that you treat.
The patients that we see in home health are people who are typically homebound. It's a taxing effort for them to leave their home to go to a clinic. So generally speaking, this tends to be more of an aged population, Medicare age, but we see a wide range of diagnoses, from strokes to after surgery knee replacements to somebody that was just in the hospital with an infection and now they're trying to get back home and back to functioning like they normally did.
And how do you assess your patient's needs?
So we do a head-to-toe assessment. We go through a lot of questions about how each system of their body is functioning. And then we do a very thorough physical examination where I'm looking at their strength, their balance, how well they can get up and move around in their own home. Gives me an idea of what we're working with so that we can set up a plan of care to improve their function. And we're also looking at what sort of equipment they might need so that they're safe and they can stay at home optimally.
And explain to us, how do you apply physical therapy in the home setting outside of a gym?
In a home, we do have to be creative because I'm not bringing a gym in my car, that's for sure. So I like to use things that they already have in their home. But for the most part, most of these folks that we're working with are relatively low functioning. So basic mobility is a big part of what we do. Can you stand up? And in fact, we can use that as an exercise. We might use a can of soup. We do have Theraband we can bring into the home, exercise balls, balance pads, just little simple things that we can bring in.
But this is more about functionality inside the home.
Yes, it is all about functionality in the home. So we're working a lot on balance, walking, your ability to get up and move around safely.
And in speaking of that, how are you addressing the pandemic and keeping your patients safe?
We are working with a demographic of patients that are high risk for this infection. So we're dealing with an elderly population, Medicare age. So they're already at risk just because of their age. They're coming out of the hospital. They have multiple comorbidities like diabetes, COPD, cancer, you name it. So we do need to protect these patients. So we wear masks in the home, we have gloves, and we're sanitizing our hands multiple times with every visit.
And where can our viewers go to learn more?
You can always look us up on our website at saltzerhomehealth.com.